When you use the term flare, that suggests that your Crohn's is worse, that there's more inflammation inside. But people could have worsening stomach pain, worsening diarrhea, or weight loss, and their Crohn's could be just fine. So with Crohn's disease, how you feel doesn't go along with what's going on inside. So you could take two people with the same amount of inflammation inside, and one person that's on a perfect diet, that has zero stress in their life, maybe goes to the bathroom 5 times a day. You take another patient with a horrible diet and a lot of stress, they might go to the bathroom 10 times a day, but the amount of inflammation on the inside is exactly the same. So if symptoms do worsen, it's important to communicate with the provider so then they could better help figure out what's driving those symptoms. Is it Crohn's or is it something else? I wouldn't recommend rushing to taking something over the counter or adjusting or increasing medications without getting a better sense on what's causing the symptoms. Common triggers for worsening of symptoms, it could be non-compliance to medication, so not taking the medication. Sometimes certain foods might trigger worsening of symptoms, not necessarily worsening of inflammation, but that they feel worse. Stress, similarly, can make symptoms worse, but not necessarily cause more inflammation. So to minimize the risk of flaring, the most important things patients could do is take their medications, come to follow-up visits, even if they're feeling well, and get the required blood work and stool tests. But I think the important thing is to give the office a call. I don't think that patients should go run to an emergency room. That's not a good idea unless the symptoms are very severe. But I think just giving the office a call, and whether it's getting in contact with a nurse, a physician assistant, or nurse practitioner, emailing with the doctor, whatever it may be, and then working with them to come up with an answer.